Hello, I'm Samantha Stageman, and I'm a third-year doctoral student at Wright State University School of Professional Psychology. And today I'm going to be talking about barriers and facilitators to substance use treatment among pregnant women. My faculty advisor on this project is Dr. Beth Hurt, and please see the QR code on the screen if you would like to see the full research poster for this presentation. So to start, I'm going to go over some introductory information. So substance use during pregnancy can negatively impact the health of the mother and unborn child. For instance, pregnant women can be impacted by feelings of guilt, which can affect their mental health, and they can experience complications during the pregnancy. Regarding the child, substance use during pregnancy increases the risk of fetal growth restriction, early birth, substance withdrawal post-birth, and later developmental and behavioral concerns. And according to a national survey that was done in 2020, 8.3% of pregnant women reported using illicit drugs, 8.4% of pregnant women reported tobacco use, and 10.6% of pregnant women reported use of alcohol. Okay, so now I'm going to discuss the barriers to substance use treatment. And first, I'm going to talk about mental health related barriers. So, women using substances while pregnant can feel guilt and shame because they're aware that their substance use can cause harm to the unborn child. And these feelings can become exacerbated because society at large looks down on pregnant women who struggle with substance use, which can lead women to experience depression, anxiety, and poor self esteem. Ultimately, the stigma becomes internalized, and pregnant women avoid disclosing their use to anyone. Also, women can experience stigma directly from treatment or healthcare providers. Another barrier are fear-related barriers. So pregnant women fear that if they seek treatment, that they're going to be reported to Child Protective Services, that they're going to lose custody of their unborn child and other children, and they fear that they will be prosecuted for their substance use. Next, I'm going to talk about facility-related barriers. So some treatment facilities have long wait lists, and others are simply unwilling to treat pregnant women for substance use. Another barrier that pregnant women face is a lack of awareness or understanding of their treatment options. Some women believe that treatment facilities would only provide them with a place to detox and that no other services would be offered. Other barriers to substance use treatment are related to accessibility and basic needs. So some women do not have transportation or they don't live within a reasonable travel distance to treatment facilities. Some treatment facilities don't accept insurance, which can make treatment costly and inaccessible. Treatment can also be challenging to attend when women experience housing instability and difficulties meeting their basic needs, since addressing those needs may take priority over treatment. And then women also experience barriers related to other people in their lives. So some women may not have childcare for their already born children. Also, some women are victims of intimate partner violence and they fear leaving for treatment because of their partner's physical and financial control. Women may also be encouraged to continue using substances by their partners. And so those were the barriers. And now I'm going to switch over to what may facilitate pregnant women's treatment seeking behaviors. A key facilitator of treatment seeking is the mother's concern for the baby's health. Women also added that with the upcoming birth of their child, they wanted to change their lifestyle or add structure to their lives to prevent relapse, which treatment could support. Women also expressed that they no longer considered an abortion or had access to an abortion, which motivated them to seek treatment in order to reduce any harm caused to the child. Another facilitator included receiving support from other people in their lives. Also, some women seek out treatment because they're aware of facilities that prioritize treating pregnant women for substance use. And then women also seek treatment since inpatient facilities can provide them with temporary housing stability, and treatment can also serve as a way to escape intimate partner violence. And so the last thing that I wanted to cover is what treatment should involve. So substance use treatment during pregnancy should be multidisciplinary, trauma-informed, and operating from a harm reduction lens. So the Center for Addiction and Pregnancy at Johns Hopkins is an outpatient facility that follows these recommendations. The program operates from a trauma-informed lens and provides psychoeducation and different services. These services include offering beds for pregnant women experiencing instability in housing, providing group and individual substance use counseling, medication support, medical care, and case management for legal and basic needs. And that's the end of my presentation. Thank you so much for listening.